communication gap between AI model and this study explores the challenge and potential of integrating explainable machine learning model in clinic decision-making, with a specific focus on healthcare professionals' interaction with these models. The research introduces a novel framework for evaluating the practical utility of explainable explainable ML models in clinical settings. Examine factors such as user trust, understanding, and satisfaction using CORNET and COVID-19 risk oncology evaluation tools. The study assessed how healthcare professionals make decisions about hospital admissions for cancer patients with COVID-19. Results indicated that while explainable AI has a potential to reduce automation bias and resist less experienced clinicals, it also raises issues such as confirmation bias and over relief on AI recommendations. The study reveals that while HCPs generally appreciate exploration as means of safety and building trust, these explorations sometimes increases conjunctivity load and led to automation bias. Additionally, many HCPs did not find explanation useful in detecting model errors or fully understanding when AI might be wrong. The study highlights complex dynamic. Although explainable AI model can support clinical decision making, particularly for ambiguous cases or less experienced professionals, they are not universally beneficial. This research emphasizes the need of further refinement of explainable ML model to ensure the efficient communication with clinicals without introducing conjunctive strains or reinforcing bias. Introduction. The study addresses a significant gap in communication between AI-driven clinical decision support and healthcare professionals. Despite the potential of machine learning models to enhance clinical decision making, there remains a lack of clear understanding about their reasoning process. This led to challenges in building trust and understanding between HCPs and the systems. Explainable is a key factor to bridge these gaps as it can help HCPs and evaluating AI generated decisions, thus improving their adoptions and reliance on these tools. Recent research has focused on making ML models more accessible, but the actual utility of and trustworthiness of these explanations in clinical settings have not been thoroughly investigated. This study aims to explore the issue of providing explainable ML outputs in clinical decision making. It evaluates whether explanation improve trust, satisfaction, and critical understanding among HCPs when coordinate a tool designing for managing COVID-19 risk in non-polygal patients. The article accessing the communication gap between AI model and healthcare professionals explores the relationship between healthcare professionals and explainable machine learning models, focusing on the use of model in clinical decision support system. The author identification of communication gap where despite general positivity towards explainable, many HCPs struggle to fully understand or trust ML-driven recommendations. This study utilizes Cornet, a clinical decision tool for managing COVID-19 or polygal patients to evaluate how explanation influences HCP's decision making. The study found that while explanation reduced automation bias and helps HCPs with ambiguous cases, they also increased confirmation bias and did not always improve critical understanding. The methodology involves 23 healthcare professionals using Cornet in two conditions, with and without explanation for ML models predictions. The study aimed to determine whether explanation improved trust, satisfaction, and understanding. However, the results were mixed. While HCPs appreciated the future-based explanation provided by models, a significant number of 70 to 35% experienced negative effects, such as increasing con- The study also identified the explanation to reduce automatic automation bias by encouraging users to reflect more on decisions when the model's recommendation contradicted their initial judgment. But it also highlighted the risk of confirmation bias. The findings suggestion that simply added explainable to ML models is not enough to close the communication gap between AI and healthcare professionals. The author advocated for more programmatic approach in designing and embedding explanation ML models in clinical workflow, emphasizing the need of co-development with domain experts, ensure explanations are both useful and usable in real-world settings. Furthermore, the case study indicates that further research should focus on balancing explainable with conjunctive load and usability to avoid consequences like over-reliance or reduced critical thinking. The study found mixed response to inclusive of explanation in the decision-making process, while 85% of participants appreciate knowing which feature contributed to model's recommendation. Only a small percentage reported improvements in trust or satisfaction. The explanation did not significantly change how HCPs viewed the model's usefulness or their confidential in decisions they made. Suggestions that adding explainability did not enhance trust or critical assessment as expected. Moreover, the explanations were easy to interrupt for most participants, but did not continuously lead to better decision making. In some overridden or models recommendations, even when explanations were included, it would increase automation bias. Participants made quicker decisions when the model agreed with their initial assessment, showing that explanations may not always encourage deeper reflection. Discussion. The finding revealed that while explanation can provide valuable insight into the working of AI model, they do not always enhance clinical decision making. The fact that explains did not consequently include critical understanding suggests that more work is needed to make them fully useful in clinical settings. Instead of providing simple future importance, further models should focus on reducing conjugative loads and delivering explanations that are closely aligned with clinical reasoning. Another key takeaway in potential for over-reliance on AI system. Even when explanations are provided, the highlights that needed for HCPs are to critically engage with AI output and not rely solely on automated recommendations. This study also suggests the less experienced HCPs may benefit more explainable models and they tend to trust models output more than other experienced counterpart. In conclusion, this study contributes to ongoing research on explainable AI by providing a paragrammatic framework to evaluate ML models in clinical settings. It highlights the complexity of embedding explanation into clinical decision-making process. While explanation can serve as safety mechanism and build trust, they may also introduce new challenges such as confirmation bias or over-reliance on the models. Ultimately, the study underscores the need of further research into how explanations can be better tailored to clinical overflow. Further effects should aim to develop explanation to enhance critical understanding, reduce conjunctive loads, and facilitate the appropriate use of AI in healthcare. By fostering better collabora- collaboration between AI research and clinicians, explainable models can play more efficient role in improving patients' outcomes.